25 years, the Medicare Rights Center has successfully reached out to tens of millions of Medicare-eligible Americans in order to help them get quality and affordable health care. Since 1989, the Medicare Rights Center staff has met the challenge to help those millions of people with Medicare navigate through the complex Medicare maze.
For a decade now, the Medicare Rights Center has been a tireless advocate of older and disabled Americans, working day in and day out to ensure that they have access to good and affordable health care. With education, training, and service programs like your Medicare Hotline Assistance Partnership, you've also played an important role in making Medicare work for those who can't afford to fill their prescriptions or get access to essential health care services.
And for 25 years, the Medicare Rights Center's goals have remained the same: to reach, to educate, and to empower millions of Americans in need of health care. The dedicated, dynamic, and knowledgeable staff and volunteers continue to meet these objectives through counseling, education, and advocacy and public policy initiatives. During the last quarter century, the Medicare Rights Center has resolved an estimated 250,000 complicated Medicare issues for our helpline callers. This translates into an estimated 200,000 hours of time provided by our dedicated Medicare rights volunteers. And as a result, more than $50 million worth of benefits have been put back into the pockets of low-income Medicare beneficiaries. In fact, the Medicare Rights Center has gained such a reputation as a primary source of information that nearly 2,500 doctors, attorneys, social workers, and academics turned to us last year for information so that they could brief their own patients or clients. To keep up with the ever-growing need to help educate people with Medicare, now numbering more than 50 million strong, the Medicare Rights Center continues to introduce new initiatives, such as Medicare Interactive, an online resource which answers questions about Medicare benefits, rights, and options. Last year alone, the site provided more than 1.2 million answers. And we have Medicare Rights University, a collection of courses and resources for those who want a clear path to learning Medicare. Additionally, we continue to expand our community outreach programs such as Medicare Minutes. This is where a core of approximately 200 volunteers go into their communities in 15 states to conduct in-depth meetings in libraries, senior centers, and town halls. Last year, this army of volunteers had a combined audience of more than 60,000. Each year, the Medicare Rights Center brings a unique perspective to the national policy stage by using our vast experience of serving thousands of Medicare beneficiaries, their family caregivers, service providers, and attorneys through the many services and educational initiatives we offer. We are committed to making sure the beneficiary voice is heard and represented in federal and state arenas in order to sustain and strengthen the Medicare system. For a quarter of a century, Medicare Rights has been speaking out, and national, state, and local media has been responsive, with more than 20,000 news articles, radio and television interviews, and more recently, we are followed on Facebook, Twitter, and YouTube.
In the last few minutes, I hope we've been able to share with you how the Medicare Rights Center has evolved during the last 25 years. How it's grown from 3 founding board members and 1 staff person in 1989 to a determined, knowledgeable staff of 32 with 18 prominent board members. And how we started with a budget of $100,000, which has grown to more than $3 million in 2014. And although the federal Medicare program may be a $500 billion healthcare program intended to serve tens of millions of the elderly and disabled, including 10,000 baby boomers each day, to us, Medicare is about helping one person at a time. It's about listening to each individual client and advocating for their rights. It's about counseling, educating, and talking to the media to get our messages out. All with the same simple goal we had in 1989, to make sure our clients get the high quality and affordable health care that they're entitled to.